It's Chris from Dixieland Farm, and I'm doing a different type of video. I do usually videos about my record collection, but I am doing a video diary about my total knee replacement that's coming up. So if you're not interested, don't watch, but I figure for anybody who is interested, they can watch these videos and see what I was like before surgery and after surgery and all the parts in between. So a little bit about myself. I'm 43 years old. I've already had 3 arthroscopic surgeries on my knee. My knee on one side is collapsing, and I've had 2 injections of stem cells. I've had plenty of cortisone shots, and I've also had the Syn-Gel. It's another type of injection. None of those things have alleviated my pain. So right now, at age 43, this last few months, I've got about 5 minutes in the morning, and then I'm basically in pain the rest of the day. So it hurts to stand or walk. Basically, that's it. And getting off my feet and elevating my leg will take away some of the pain, not all of the pain. It takes a few, basically overnight to kind of reset. The knee clicks plenty. However, there is still a little bit of meat in between there. It hasn't gone completely arthritic where it's bone on bone completely. It's got a little bit of space on one side and a little bit more on another side. The last time my surgeon went in, he said that they can go in and clean it out again, but at this point you should probably just get a knee replacement. So when I started having problems this year, I went to the knee replacement surgeon at the practice that I normally go to, and he said, "You're too young. You cannot get a knee replacement. Go see the other doctor." And the other doctor said, "I'm not going to work on you because you've already had 3 surgeries. There's nothing left to do. You should have a knee replacement." So I just kept going back and forth. It was very frustrating. My wife got annoyed. I was getting annoyed, but my wife got annoyed, and she found a different orthopedic practice for me to go to. She got me in right away because she knew some people that helped out. They saw me and they said, "We'll do whatever you want. Let's take a look at the x-rays and the MRI that you already had." And they listened to what I had to say, which was an important thing. Back at the old practice, I'd seen a PA who had never actually even looked at my MRI. She just looked at my age. And it was, again, very frustrating. So far, the orthopedists that I'm seeing now are fantastic. Different experience. It's about customer service, not about turnover and quantity. So, anyway, they said we would do whatever you want, and they listened to me, and he said, "Well, yes, according to the x-ray, you are too young to have a total knee replacement. Normally they like to do that around age 60 because they last about 20 years, and then you'd have one maybe in your 80s, and then you would be dead, so you wouldn't have a second one." We already know there's going to be a second and a third knee replacement in my life, and anybody who is under the age of 50, the statistics of how happy they were with the knee replacement, the scores are much lower than somebody who's elderly who just wanted to walk around. I just want to walk around. I have no intentions of skiing, playing basketball, football, or any of those kind of things. I'd like to swim slightly and be able to walk, because on the farm I walk constantly and I'm on my feet constantly. So yeah, that is what's going on with me, and this is just video 1. One thing that my doctor said, which was really telling, he said that we treat patients, we don't treat x-rays. So just because the x-rays said one thing, he said your pain level and your experience says much more. So that is why he's doing the knee replacement. That's all he does, is knee replacements. He does 500 a year, roughly. So that will be in a week and a half. I'm doing physical therapy right now. I'll do that in another video of my pre-surgical physical therapy that I'm doing to strengthen the leg muscles. And then you'll see me probably in the hospital in the 3rd video diary. So I'm going to try to post these as life is happening, not delayed. Normally when I post my other hobby videos, there could be months between when I shot it and when I actually upload it. So this I'm going to try to keep more current. So you can ask questions live as they're happening, and I can respond, maybe even in a video form. Everybody, that's what's going on. Oh, and in case you don't know what a total knee replacement is, I forgot to mention that. So what they do with your knee is you got the top part and the bottom part, and then you've got the meniscus in between. Basically like a washer. And that washer right now has got cracks in it and is collapsing on one side. So now bone is touching where it shouldn't be touching. So what they do is they remove the kneecap. They remove everything in the middle. They shave down the bone on both sides, and they put a metal cap. So I'll have metal on both leg bones, and they put a plastic spacer in between. So I'll have metal, plastic, metal. So there will be no actual bone on bone anymore. And then they put the kneecap back in place, and they'll try to track all that. When they do the surgery, it's a robot-assisted surgery. So a robot's actually doing all the work in there, and the doctor is controlling it via controls. And the recovery period could be anywhere between 4 weeks to 12 weeks, depending on lots of things. So we're going to find out. So that is what's happening with me. Okay, everybody, take care.